Imagine waking up one morning with chest pain. Your heart races not just from fear, but from a terrifying realization. In America, that ambulance ride to save your life will cost you $2,600. The emergency room visit, another $2,400 minimum. Before any doctor even touches you, you're already facing $5,000 in medical bills. And this is just the beginning. Here's the shocking truth. Nearly 2/3 of bankruptcies in America are caused by medical expenses. Every year, 500,000 Americans file for bankruptcy simply because they got sick. These aren't people without insurance. 56% of insured Americans still carry medical debt, because even with coverage, a single serious illness can financially destroy you. Real Americans have lost hundreds of thousands of dollars because of medical bills, life savings wiped out after surgeries, or major procedures denied by insurance. It's not rare. Every day, over 9 million Americans can't afford the medications they need. They skip doses, cut pills in half, or go without entirely risking their lives just to save money. Meanwhile, crowdfunding platforms like GoFundMe have become an unofficial healthcare safety net. Around 200,000 medical campaigns are created every year, yet most never reach their goals. Why is this happening? The numbers are staggering. Americans spend $12,742 per person each year on healthcare, nearly twice as much as other wealthy countries. Switzerland, the second most expensive, spends only $9,044. And yet, American citizens not getting better outcomes. Consider this. A simple MRI costs up to 42% more than in the UK and as much as 4 times more than in Australia. Prescription drugs? Americans pay 2.78 times more than other developed countries, and for brand name medications, the cost is over 4 times higher. Insulin, the lifeline for diabetics, costs nearly 10 times more here than anywhere else in the world. But here's what's really broken. It's not just about the medicines or procedures, it's about the system itself. Administrative costs alone account for 30% of America's healthcare spending. Hospitals spend over 40% of their budget just on paperwork and insurance battles. Americans waste an estimated $528 billion every year on administrative complexity money that produces nothing except frustration. Why? Because America is the only developed nation without universal healthcare. US have a patchwork of competing insurance companies, each with different rules, different forms, and different ways to deny your care. Doctors need entire departments just to figure out if your insurance will pay. Meanwhile, countries like Canada, where healthcare is a right, spend only half as much per person while covering everyone. This isn't just about money, it's about human suffering. Medical debt has pushed billions of people worldwide into poverty, with America leading the charge. Families lose their homes, their savings, their futures, not because they lived recklessly, but because someone got cancer, had a heart attack, or broke a bone. The cruel irony? America has some of the world's best medical technology and doctors. US pioneered countless medical breakthroughs. Yet America is the only developed country where getting sick means choosing between your health and your financial survival. Americans are becoming medical refugees in their own country. In 2020, hundreds of thousands traveled abroad for care, even during a global pandemic. They're flying to India for heart surgery that costs $5,800 instead of $40,000. To Thailand for procedures at a fraction of American prices. US citizens has become medical refugees in their own country, forced to seek affordable care anywhere but home. Meanwhile, in France, the government negotiates drug prices based on clinical value. In Canada, essential healthcare is free for everyone. South Korea covers 77% of medical expenses through universal healthcare, and they're consistently ranked as having the world's best healthcare system. But there is hope. The solution isn't mysterious, it's proven. Universal healthcare systems work in 70+ countries worldwide, covering 70% of the global population. They cost less, cover everyone, and produce better health outcomes. The question isn't whether we can afford universal healthcare, it's whether we can afford not to have it. Every day we delay, more families face financial ruin, more people ration their medications, and more Americans discover the terrifying truth. In the land of the free, getting sick isn't just a health crisis, it's a financial death sentence. The next time you see a medical crowdfunding campaign, remember, this isn't charity, it's a symptom of a broken system. Because in America, the most expensive healthcare system in the world, your ability to live shouldn't depend on the kindness of strangers on the internet. What if you get sick in America? Now you know the answer. The question is, what are we going to do about it?